Well, hi, my name is Linda Park, and I'm a dentist. I've been a dentist for 33 years. I graduated from University of Michigan Dental School. And when I went to dental school, it was learning about how to be a tooth doctor. And I've been a tooth doctor for a lot of years. But back in 2008, I had breast cancer. And that for me was game-changing and life-changing, really, because I had been healthy all my life. I was a busy working mom with 3 kids and a busy practice. And I developed breast cancer. No history of breast cancer in my family. No particular reason I should have gotten it except for the stress that I had probably and just the standard American diet. Well, that started my journey to start thinking about, okay, there's more to life than just doing dentistry, being a mom. Why did I have breast cancer? Why did that happen? And what in my diet contributed to it? What in my lifestyle contributed to it? So all of that started me on a journey of figuring some of those things out. I ended up going to a conference. It was an integrative dental conference, and I learned a lot of things there about the inflammation or the fire inside of us and what causes that. There are many things that can cause it. Diet, lifestyle, those are the 2 big things. Genetics, of course, plays a role, but all those things can add up to what you're going to be susceptible to. And it's different for everybody. For me, it was breast cancer. So I also had my gallbladder removed. This is a lot of personal information, but it all contributed to what the journey that I set out to be on. And what I learned at that conference is that this inflammation that's what contributed to my breast cancer. That's what contributed to my gallbladder needing to come out. And so what caused the inflammation? So what we've come to realize is that improper airway function is a contributor to inflammation. And I learned that also through something in my own family, and that is my youngest son. He had anxiety and terrible sleep most of his childhood, and it was a struggle. Many nights and many days taking him to school. A lot of anxiety. And I didn't know then what I know now, and that is that airway has to be proper 24/7. He was a mouth breather. He was breathing through his mouth when he slept, and he was breathing through his mouth somewhat during the day, but mainly when he slept. He had huge tonsils that were always inflamed, and he would get strep throat often, he would get sick often, and I didn't know. What I knew and what I learned at the conference that I was talking about that I went to. And what he talked about was sleeping with your mouth closed. Well, when we're sleeping, we don't know what's going on, and people's mouth tends to fall open. That's what happened with my son. And it was a simple fix. I ended up getting some tape for him, which I know sounds crazy, but it's just gentle paper tape that I had him place on his lips like this, and being able to keep your mouth closed when you sleep reduces inflammation. So there's no more inflamed tonsils, there's no more inflamed gums, and it reduced his anxiety. So it changed him from being able to not wake up stressed and anxious, because breathing through your mouth when you sleep increases your stress response. You're releasing cortisol all night long, and you're struggling to stay alive because you're breathing through a coffee straw instead of breathing through a garden hose. We were designed to all breathe through a garden hose. So explaining that a little bit, nasal breathing allows you to have diaphragmatic breathing. Diaphragmatic breathing is parasympathetic function. That's rest and digest, rest and relax. Sympathetic breathing, that's upper chest breathing, is mouth breathing. And that is living high anxiety, living way up here. So you can imagine when you're sleeping, if you're breathing through your mouth at night, you're living up here and you're sleeping, you're not getting good sleep. And when you don't get good sleep, you wake up at a certain level of stress that you wouldn't have if you were breathing through your nose. So it causes all sorts of anxiety issues. It can cause ADHD, and it can cause poor concentration, poor focus, poor sleep. Believe it or not, diaphragmatic breathing contributes to posture, spinal support, and jaw development. So when you're breathing through your mouth, you can imagine your mouth is open, and it can create this sort of situation, narrow jaws. And when you have a narrow jaw, it's hard to close your mouth and have your tongue on the roof of your mouth. God has created our tongue to be an expander of our jaws. Why does our jaw need to be wide? It needs to be wide so that our tongue can be up on the roof of the mouth. When the tongue can be up on the roof of the mouth and the mouth can be closed, then you can nasal breathe well. So because of my son's mouth breathing, and he also was a thumb sucker, all three of my boys were, he needed braces. And so I did braces for him. I did expansion. The orthodontist that I worked with did expansion one time, and then I had to do a second expansion for him and then place braces to straighten his teeth when he was in high school. So him nasal breathing allowed him to be able to think more clearly, to have less anxiety, went on to college, actually got a Master of Divinity, and is doing wonderfully, and will tell anybody, and is a very much an evangelist for nasal breathing and the importance of it when you sleep. So now my focus is with younger children, because back in 2018, the American Dental Association recognized the importance of assessing the airway of children and adults in the dental practice. So they made an official statement that being physicians of the mouth, we as dentists have been called to evaluate the quality of the airway of our patients. And why is that? Dr. Steve Karsten said there has been a realization that proper breathing 24/7 is a critical foundation of health, and children must be observed carefully and taught and treated as early as possible in order for them to grow to their maximum potential, to grow the way genetically the Lord made them to grow. So these are some of the reasons that I ask my patients, how do you sleep at night? Because for kids, it's all about how they grow. And if you're not breathing properly when you sleep, the brain doesn't get to do the work of healing the body and of allowing the body to grow, releasing growth hormone, helping jaw development, everything that a child needs to become an adult and function well. And for adults, it means, how are you sleeping at night, as far as, that's how sleep apnea develops, and it can cause heart disease, it can cause strokes and diabetes, and those are all inflammation things. So all of these things, all of these inflammatory contributors are things that have caused me to change my focus from just being a tooth dentist to being a dentist that looks at the whole picture. So Park Dental Wellness is a place where we look at the whole picture, and whether it's sleep, diet, or how you take care of your mouth, all of those things work together for total body health. And that's our main focus. Thank you so much for listening in about the importance of airway and learning a little bit about my passion. And if you have any questions and you'd like to learn more, please feel free to comment below. And we hope to be making some more videos soon and helping everyone learn more about airway and the other things that we do at Park Dental Wellness.